What is mesh? What is alloderm? Why are we using these in breast reconstruction? Let's discuss how they can help us achieve a good breast reconstruction and why your surgeon might discuss using something like mesh with you. When we do a two-stage reconstruction where we start with a tissue expander, as a reminder, the tissue expander has little tabs around the outside of it. These tabs allow us to secure the tissue expander exactly where we want it on the chest, as opposed to an implant, which is a silicone shell filled with silicone without tabs. So in order for me to get it to stay exactly where I want it to stay without moving around, there are a couple things we can do. I can use some strategic suturing to provide almost a dam that prevents the implant from going too far to the side or too far down. But sometimes we do need extra support to keep it exactly where we want it, as the implant creates the capsule or the home around it. To do this, surgeons use a couple different tools. One is acellular dermal matrix, also known as ADM. This is human cadaver skin that's been processed so it's no longer cellular. It's not like a transplant that your body's going to reject. It actually incorporates into your own tissue. Surgeons might use this to provide an extra layer of covering or soft tissue support, or just keep the implant or tissue expander exactly where they want it. It is off-label for breast reconstruction, and it does have an increased risk of seroma or fluid collection. So that is a potential negative of using ADM, but it's still widely used in breast reconstruction. The other option, if your plastic surgeon wants a little bit of extra soft tissue coverage or wants to make sure the implant stays in place, whether it's going to the side or down, would be to use some type of absorbable mesh. There are many meshes on the market, and they all have different properties in regards to how hard they are and how long they last. I'm a huge fan of DuraSorb. That's just what I use in my practice when I do direct implant reconstruction, but it's something that we talk about at meetings, and everybody uses different ones. We all have our own individual preferences. But this is very commonly used in direct to implant reconstruction and sometimes used when people are putting in tissue expanders. It really varies surgeon to surgeon, but this is something that would be on your permission form for the day of surgery. If you had reconstruction, did you have a mesh? Did you have ADM? Did your surgeon talk to you about it? If so, let me know below.